Let's talk about chest tubes. It's important to know there are two types of chest tubes. A wet suction, which uses water to create the suction, and it's a closed system, where a dry suction chest tube may connect to wall suction or is controlled by the dial on the system. A chest tube has 3 chambers: a drainage collection chamber, a wet seal chamber, and a suction control chamber. Let's begin with the drainage collection chamber. This chamber is where fluid leaving the patient's chest is collected. It's important to understand the different colors of chest drainage you will see in this chamber. Serous or clear drainage is a normal part of the healing process. Dark red blood is also a part of the normal healing process, but purulent, green, or yellow drainage may indicate an infection. And bright red blood most likely indicates an active bleed, so this should be reported immediately. It's also important to measure and document the output in this chamber. Next is the water seal chamber. This chamber allows the chest tube to remove volume from the pleural space without outside air entering. It does this by creating a one-way valve or vacuum. You'll fill this chamber with sterile water only, and you want to assess the level of water and add if needed. Remember, water can evaporate. Water in a water seal chamber should tidal, meaning the water levels should rise with inhalation and fall with exhalation. Tidling indicates a properly functioning system, where continuous bubbling in the water seal chamber indicates an air leak and is not expected. Where lack of bubbling or no bubbling at all in the water seal chamber could mean 2 things. It could mean the tube is kinked or occluded, or that the lung has re-expanded. This would require further evaluation. Now our third chamber, which is the suction control chamber. Remember, a chest tube can be a wet or a dry suction. The amount of water in the suction control chamber determines the amount of suction it will provide. A wet suction may be connected to wall suction. The suction settings will be ordered by the provider and changed on the wall suction dial. Where dry chest tubes will have a dial on the actual system, which controls the strength of the suction pulling blood, air, or fluid from the patient. You can remember this by the memory trick, dry, think, dial. Remember, it's directly on the actual system. The most common settings are -20. In a dry system, a red or orange bellow will move with suction. This is a good sign and indicates that the system is working. If you want the rest of this video, check out Nurse in the Making Plus. This includes access to our growing video library, interactive worksheets that go with each video, and practice questions. You can get access to Nurse in the Making Plus with the Complete Nursing School Bundle. Click the link to the Complete Nursing School Bundle and join thousands of other future nurses using Nurse in the Making Plus. You got this, future nurse.